Good evening. Good evening. Um, let's see if there's anybody. I see there's one person already on here waiting. Good evening. Sorry I'm late. The time got away from me. I was literally just got in not too long ago and I got busy and didn't even realize the time, but we're going to get ready to get started. We'll be getting started in just a moment. If you are
Crypto for all means more
sorry
people
about
can.
this. Let me turn this off. If you are watching live with me, do me a favor and comment hello down below, just well in the comment section so I know. Hey, Brittany, I see you back with me. Thank you for joining me again, Brittany. Um, um, Brittany, let me know where you're watching from. I know you were with me before. I can't remember where you were watching from, but do me a favor, let me know where you're watching from. And if there's anybody else on here, we're going to get started in just a moment, but I want to wait a few minutes. Let me know where you are watching from. If you're watching live, just do me a favor and say hello. We're going to get started in just a moment. I see Brittany's here, Janice D. I'm hoping I'm pronouncing this right. Janice D, Dallas. Okay, so I see Janice D's from Florida. Let me know if I'm saying it right, Janice D. Brittany's from Tennessee. Dallas is from Texas. Oh, Dallas is from okay. The reason why I wanted to know where you're watching from, just to kind of get an idea of where people are located. If you've watched my video on the truth about becoming a medical assistant, you'll know that I mentioned there that some of our duties may vary from state to state. Like some of our scope of practice may vary. Like one, as a matter of fact, somebody commented the other day that in New York they can't give injections. I'm from DC. We can give injections, we can draw blood. And so that's one of the reasons why I like to know where you all are watching from. Hey, I see Veronica's back. Cassandra. Hey, Cassandra, welcome. Lady Brab 181 is also watching from Texas. Um, oh, you watched part one. Good, Cassandra. Perfect. Okay. Veronica's New York. Oh, she passed. Congratulations, Cassandra. I gotta shout you out in my next video. I didn't get this comment in time to include you, but I will definitely shout you out. If this is your first time watching, I like to shout people out during the video. So Haley says she's watching from San Francisco Bay Area. Okay, perfect, perfect, perfect. So, and I see Dallas says she's studying to be a CMA. Oh, she's in high school. Perfect, Dallas. You're starting very early. Perfect. I'll actually be teaching high school students this summer at a program we are partnering with. That is exciting. You're starting very early. And let me know what you plan to do after Dallas, after you get your certification. Are you plan on becoming a nurse eventually, or you just kind of want to work as an MA for a while? Let me know. We're going to go ahead and get started. I want to shout out a few people here. So this is the reason why I want you all to let me know when you pass your test. So first, I want to start with Andre. Andre said he passed with a 400. Congratulations, Andre. Curly MHT passed with an 82%. Melissa passed with a 405. Goddess Noel says, thank you for the videos on your page. They definitely helped me in the long run. She said she passed her CCMA exam. Teresa Scott also passed her CCMA exam. And also Garth, he passed. I'm not sure if Garth is a woman or male. I'm sorry, Garth, if you're watching. But they passed with a 403. So I just wanted to congratulate you all. So definitely, guys, let me know when you all pass your test so I can shout you out. And for those of you that are new here, my name is Kendra, or AKA Miss K. My students gave me the name Miss K. I'm a medical assistant and medical office assistant instructor. So you'll notice from my channel that I post content, on both certified clinical medical assistant as well as certified medical administrative assistant. So I teach both the administrative and the clinical side. So these people that I shout out, they're taking both the clinical exam as well as the administrative exam. All right. Mr. Lorsfino says he's in Connecticut. Haley, she says she has a question about the CMA exam. Go ahead and put it down below, Haley, your question. So many of the questions on your review were relevant to what was on the test. Thank you for mentioning that. That's going to take me to the tips. So, ladies and gentlemen, I just want to go over just a few tips before we get into the exam practice. So, number one, let your life revolve around your study materials leading up to your test. This is one of the things that I tell my students. Let your life revolve around the materials. This means I want you to wake up and go to sleep medical assistant, right? So if you're taking a CMAA or the CMA, whatever test you're taking, let your life revolve around it. Let's just say, for an example, somebody told me they're taking their test on the 25th of this month. So that means these next few weeks, you're going to be waking up and going to sleep the material, especially the material that you realize where you fall short. Okay. Another thing I recommend is joining medical assistant groups on Facebook. There's a couple groups on Facebook that I've recommended, and I can add that to the comments below. I'll do that later for any of you guys that are interested in joining a medical assistant groups. I'm a part of a few on Facebook. I do recommend it because there are people who are constantly commenting in those groups. They have study materials. They are forming groups, right? So I definitely recommend joining medical assistant groups on Facebook for those of you who have Facebook. Also, pay close attention to wrong answers on the practice test, and you'll see why. As we're going through these practice test questions tonight, pay attention to the wrong answers. Why do I say that? Because if you see certain terms mentioned as wrong answers, meaning let's say the answer is B, right? Pay attention to A, C, and D, because those terms, because it's on there, because it's on that practice test, just kind of expect to see that on an actual test. Okay. Also, one thing I didn't put on here, I should have put on here, was to not focus too much on the question itself, but the content. Okay. So the content, meaning don't try to memorize the question. So many people go in thinking that they're going to see the exact questions, and then they get discouraged because they say, I didn't see any of these questions. Some people do, but I don't want any of you all to get caught up in the actual questions. Pay attention to the content. Okay. Pay attention to the wrong answers. Okay. Study those as well. Also, create flashcards and have a family member or friend quiz you. Some of my students have done that, right? Create flashcards with certain terms on it, whether it's medical terminology, or just the meanings of certain definitions that you've certain medical terms that you've had a hard time with, and let your family member quiz you, see how much you know. And then when you're taking the test, I want you all to think about process of elimination. I'm pretty sure we all learned this in grade school, right? The process of elimination, eliminating answers that you absolutely know is incorrect, right? Some questions you want to, that's what's going to lead you to the right answer, and you'll see some of that tonight. We're going to talk about that with these practice questions. And then lastly, answer all your easy questions first, and then flag the difficult questions to come back to later. So you get 3 hours to take your test. You want to just fly through your easy questions first. Anytime you come to a question in which you need to spend a little bit more time on, flag that question and come to later. All right. Don't spend the majority of the beginning of your test trying to get through difficult questions. Those questions that you need to use process of elimination with and think about, come back to those later. Okay. So those are just a few tips. I have more, but that was what I could think of when creating this presentation. If I think of more, I would definitely add them later. Also, let me know if you all have any questions, specific questions about the test, or just questions in general. Let me know. Let me just check this comment section really quickly. So Dallas said her hopefully going to nursing college. Okay. All right. Yes. Okay. So we'll ask about some relating to CMA exam, but that's not how many answers to apply to or more. Haley, I'm not exactly sure what you're asking. It sounds like you're talking about when there's two answers that you can choose. There, every now and then you may see a question in which you have to click all that apply. I think that's what you're asking. Let me know if I'm thinking correctly. All right, so let's get ready to start. So for those of you, this is your first time here, the way this works, I'll read the question, give you guys a few seconds, about 30 seconds or so, to put your answers in the chat, and then I'll go ahead and reveal the correct answer. So let's go ahead and get started. All right, number one, how should the MA greet a new patient that has arrived to the office late? Have a seat, we will be with you shortly. Hello, welcome to our office. What is your best phone number? We couldn't reach you this morning. Or please complete these forms and return them to the desk. A, B, C, or D. How are we going to greet a new patient that has arrived late to the office? Okay, Veronica, I see you said you're interested in the Facebook group. Okay, so I'll make sure I link that group down below. I definitely will. Okay, so I see the majority of people are saying B. Okay. All righty, so let's see. Yes, so those of you that chose B, that is correct. So one thing I can say about the CCMA exam specifically, you get a lot of scenario questions like this, right? So when you have questions like this, think about what is the most professional. So we will be with you shortly. That's something we'll let them know, after we welcome them, right? After we say hello. Each of those other options, none of them says, even though those are things we may say to the patient, none of those are professional because none of those greet the patient. So when you have these scenario questions like this that ask, what would you say? What should you do? Always go for the most professional response, right? Hello, welcome to our office. All right. Now, will we have them fill out forms and return them to the desk? Yes, eventually. But we're going to first greet them and say, hello, welcome to our office. And then we'll, say what comes after that. Okay. All right. So, when collecting a blood sample, which of the following tubes should be drawn first? The light blue, green, gray, or yellow? When collecting a blood sample, which of the following tubes should be drawn first? Give you guys a few moments. Okay, I'm seeing different answers here. I'm seeing A, C. Give you guys a couple more moments. I'm seeing D. All right, so let's see what the correct answer is. All right, so the answer is going to be yellow. So I will tell you all this. For those of you that are taking the CCMA, if you're taking the CMA, Certified Medical Assistant, or RMA, make sure you're familiar with this order draw because you will see these type of questions on the test, right? I mean, every question we go over, you'll see those type of questions, but just make sure you know that order draw because I know for a fact you'll see these questions, okay? So we're going to draw the yellow. Blood culture always come first because we have to use an antiseptic before we draw this tube. Okay, so yellow is going to come first, and of this list, we would do the yellow first, and then the light blue, and then that green would come, and then gray would come. Right. So make sure you're familiarizing yourself with the order of draw if you don't already know it. Veronica says yes. I wanted to correct it. We just did that today. Okay. All right. Next question. An EKG tracing shows ventricular fibrillation on an unconscious patient. Which action should you take first? Are you going to notify the provider of the arrest, call for help and begin CPR, get the automated external defibrillator, or are you going to administer oxygen? I'll give you all a few moments to get your answers in. Okay, I'm seeing the majority of people putting in B. Let's see if anybody else, any other answers are going to pop up. Yep, I'm seeing B. Looks like everybody is saying B. Let's see if that is correct. Absolutely. We're going to call for help and begin CPR. So if the patient is unconscious and the EKG shows ventricular fibrillation, we're going to call for help and begin CPR, right? So everything else we're going to do, notify the provider, get the automated external defibrillator, administer oxygen. Those are things that's going to come secondary to calling for help and beginning CPR. So for those of you who have already taken your CPR classes, then you know the very first step is calling for help. We call it activating the emergency response. Okay, I am a CPR first aid instructor. By the way, I do have a video talking about that on this channel if anybody's interested in it. But that's the first thing I'm going to do, activate emergency response, and then we're going to begin CPR right away. Now, while you are beginning CPR, your co-workers are going to notify the provider, get the AED, administer oxygen, right? When that time comes, if the patient comes to, right? Your co-workers are going to do that. This is why it's so important to have a plan in place. When you guys get to your office, you'll have some type of plan in place as to who does what in case of an emergency. Somebody's going to be responsible for grabbing oxygen, grabbing the crash card, and calling 911, right? But in this case, because you're with the patient, your job is going to be call for help and you're going to start CPR. Okay. All right. Which of the following techniques should be used when bandaging a wound? Are we going to wrap the wound from distal to proximal? Bandage fingers and toes to prevent further injury? Extend the wound dressing 3 to 5 inches beyond the bandage? Or are we going to moisten and apply ointment before bandaging? I'll give you all a few minutes, well, not a few minutes, but a few seconds to think about this. And it's okay. Just always like to point out, it's okay if if you put an answer and it turns out to be wrong. This is what this is for. You're not being scored on this. This is what it's for. When you all go take the practice test, I want you all to make sure you are testing off the top of your head. It is very tempting to take the practice test and look stuff up online, use your book, but really test yourself so that way you know truthfully where you are. You know where you fall short, you know where your strengths are, right? So it's okay. This is exactly what practice is for. All right, so let's see. All righty, so we're going to wrap the wound from distal to proximal. So those of you that said A, you are correct. As far as bandaging the fingers and toes, actually, we're not going to bandage your fingers and toes. That should be left out, okay? And then extending the wound dressing 3 to 5 inches, that's incorrect. It's going to be 1 to 2 inches. And then we want to make sure the area is actually dry. We want to clean it and dry it. So we're not going to moisten and apply ointment before the bandaging, okay? So the answer is A. All right. When trying to clear debris out of a patient's eye, which of the following actions should the MA take? Use a clean, dry piece of gauze to sweep the debris out of the eye. Position a bulb syringe on the lid of the eye during extraction. Irrigate the eye starting at the inner canthus and flowing to the outer canthus. Or are we going to irrigate the eye by flushing it with cold tap water? This is another one I'll give you all a few seconds to think about and put your answers in. Okay, I see some answers here, but I can't tell if this is from the last question or for this one. All right, well, okay, so I see some popping up now, and I see people saying B. I see see A. All right, see C, D, C, okay. All right, so let's see. All right, so this answer is going to be C. We're going to irrigate the eye starting at the inner canthus and flowing to the outer canthus. So whenever we're clearing anything out of a patient's eye, we're always going to start from the inner canthus to the outer canthus to get it all cleared out because we don't want to wipe it further into the iris, wiping it further into the eye. So we're always going to go from inner to outer. And I will tell you this, there is a question on the test that's tricky, and it'll say irrigate from the outer to the inner. So just be careful with that because these questions kind of, they do kind of get tricky. So that's one tip that I would add to is read every question carefully and read each choice carefully because it can trip you up, okay? It can change any little word and it'll make the answer completely wrong, okay? So pay attention. Another thing I want you to all to pay attention to is keywords and the questions like first. What is the first thing you do? What do you do initially? What is priority? That's another thing I would add, okay? All right, so use a clean, dry piece of gauze. If anything, we want to moisten the gauze a little bit so that pieces of gauze are not getting caught in the eye. We don't want anything on the lid of the eye. And then we're not going to use cold water. If anything, we want to use like warm water or room temperature water. We don't want to use cold water. Okay, so we can rule all of those out. And that's just that was just an example of just ruling things out. That's why it's so important to flag those hard questions first and come back to them. So that way you can have time to read each one carefully and rule out those options. All right. How can you observe a patient's understanding of insulin administration? Observe the patient as he or she performs a self demonstration, provide the patient with written instructions, offer the patient a website to visit for directions, and repeat the instructions to the patient. Okay, I'm seeing A. Oh, Mr. Lost for now. I get it now. I think I can't remember what I meant, what I how I pronounced it at first, but I get it now. Mr. Lost for now. Okay. All right. So I see the majority of people. I see A. I see D. A. Okay. So I see a mix between A and D. Everybody's okay. Looks like everybody's saying A and D. All right. So let's see. So it looks like everybody's pretty clear that it's not B or C. And that was one of the things that I meant when I said, when you're using process of elimination, it looks like you all who chose A and D, it looks like you all use process of elimination to eliminate B and C. And now you've come down to A and D. And sometimes it's like that, right? Sometimes when you're taking these tests, you're going to see questions you never seen before, some material you never seen before, and it's really going to come down to ruling out, eliminating. All right, so let's go ahead and see. All right, so for those of you who chose A, that is correct. So we want to observe the patient as he or she performs a self demonstration. So, another quick tip, when you all have these questions about, what's the best way to observe a patient's understanding, or what is the best way, you know, um, the most effective way to make sure your patient understands, it's always going to be he or she either performing it themselves or repeating it back to you. So when you see those questions, whether you're taking a CMA, CCMA, RMA, or whatever, it's always going to be that answer that says that he or she is either demonstrating it for you or repeating the instructions to you, because everything else, we're kind of leaving it up to the patient to understand, but there is no real way, right? Giving them written instructions, giving them a website, even repeating the instructions. So that's, repeating instructions, we're making sure we're giving the instructions to the patient, but that does not let us know that the patient fully understands, okay, the instructions. All right. So, next question. Which of the following is not true of an extended release pill? It can be crushed or chewed if it's too hard to swallow. The patient should drink plenty of water when taking the extended release pill. Extended release pills provide a consistent amount of medication for my body to use over a period of time. It should be taken at the same time each day. Now, in this question, I have capitalized not true, right? So that way, it, I wanted to highlight that for you. So, what you're looking for. You're looking at what's not true. But when you're taking a test, they're not necessarily going to have not highlighted for you. So another reason why I say make sure you're reading the question carefully, because you might miss that not. I'll be honest with you. When I first came across this question, I missed the not, right? And I picked the one that was true right away. I instantly went to. I'm not going to tell you what I went to, because then I'll eliminate an answer for you. But it got me. So I want you all to be careful with that, paying attention, because I'm thinking it's saying which one is true, and I went straight for the answer that I know for a fact is true. So just a little piece of advice: be careful, okay? All righty. So I see a lot of A. I see B. All right, so it looks like the majority of people are saying A. All right, let's see. That is correct. So this is what is not true. It should not be chewed or crushed. An extended release pill should not be chewed or crushed. The patient, B, C, and D are all true. The patient should drink plenty of water. C, extended release pills. Now, that was the answer that I chose when I very first saw this question, because I went for what is true. I knew for a fact C was true. So that's why I said just be careful. And then also D, it should be taken at the same time each day because, medication taken at the same time each day, it just ensures that the medication is being distributed properly. All right, next question. You're checking blood pressure and listening with the stethoscope. When should you read the diastolic pressure? When the sound disappears, when repetitive sounds begin, when the sounds change from strong to muffled, or when the sounds change from swishing to sharp. Checking blood pressure. You're trying to measure the diastolic. You're reading the diastolic pressure. Okay, I'm seeing some A's pop up. Okay, I see A's. I see C. All right, so let's see. All right, for those of you that chose A, you're correct. When the sound disappears, so systolic pressure we know is when we're checking blood pressure, and we're listening. When that sound starts, that's the top number. That's your systolic pressure. And your bottom number is going to be your diastolic pressure when the sound disappears. Everything else, repetitive sounds begin, strong to muffled, swishing and sharp, those are all incorrect. It's when the sound disappears. All right. So it's an administrative question. So even though this is a CCMA certified clinical, there are some administrative questions on here. So don't be surprised when you see those. Not a lot, just a few, but just be prepared. So just make sure you all are also, looking into your administrative content as well. But when preparing a CMS 1500 form, which of the following is required? Physical address where the injury occurred, patient's health savings account number, the current procedural terminology code, patient's medical record number. The CMS 1500 form. What is a CMS 1500 form? If you know what a CMS 1500 form is, then you know what needs to go on it and what doesn't need to go on it. Okay, C. Okay, I see C, I see A. Okay, let's see. All right, I'm seeing the majority C's. That is correct. It's going to be the current procedural terminology code, the CPT code, right? That's the procedure code. That's what tells the insurance company what was done. That's what tells insurance company the service that was provided or the procedure that was done, right? What type of visit it was, how long it was. The CMS 1500 form, what is that? That's a claim form. I did do a video recently on the claim form and counter form, the differences, because what I noticed with the last practice test question, the last practice test session we did, there was a lot of people who were getting them confused. So I did do that video. So you guys can check that out on my channel as well if you kind of have some questions about the CMS 1500 versus the encounter form. But yes, the CMS 1500, that's the claim form. That's what we send to the insurance company so that the doctor can get paid. The physical address of the injury is not necessary. Now the address of where the service took place, the place of service code, we do include that, but not where the injury happened. Health savings account number, no. And then medical record number, no. None of that is necessary for the claim form. All right, next question. Pinworms are which of the following microorganisms? Is it fungi, bacteria, protozoa, or helminths? Pinworms. Let's see. Okay. See C. I see a couple of these. All right, I see the answers coming in. Kind of a mix. I see C, A, and D so far. And so this is one of those, this is a prime example of a question that you want to make sure you pay attention to each of these. Remember in the beginning with the tips I mentioned to make sure you pay attention to the wrong answers as well. Make sure you pay attention to these wrong answers as well, because then make sure you know what these wrong answers are, because you may see them on the test. Because they're an option, just be prepared to maybe see them on the test. But let's see what the answer is. Yes, so that's going to be helminth. So those of you who chose D, that's going to be helminth. So fungi is like yeast and mold, which I see nobody. I think one person chose A, but fungi is going to be like yeast and mold. Bacteria, those are single cell organisms. Protozoa, those are single cell parasites that are usually found in moist environments or bodies of water. And then helminths, those are parasites called worms. Okay, they can be found in animals and humans. Okay. Okay, Haley says she changed her answer. Mike. Okay, so you chose D at first and went to C. Oh, okay, yeah. So the answer, you had it right the first time. Sometimes you all can second guess yourself too. When I go, yeah, you were right at first. Sometimes when I go through this with my students, I notice that many times you second guess yourself. So be careful with that too, ladies and gentlemen. Second guessing yourself. All right. Next question. Which of the following cell structures is the source of energy for a cell? Is it the endoplasmic reticulum, ribosomes, the Golgi apparatus, or mitochondria? Mr. Lost for now said, I guessed. Brittany said she just got done with class. So you all have been talking about these in class, Brittany? All right. Let's see. I see D, B. Okay, I see D. Hey, Shalandra, good to see you back. All right, let's see. So the answer is going to be mitochondria. Mitochondria. So yes, that is what provides the energy. That's the source of energy for a cell. The endoplasmic reticulum is going to be what assists transport material through the cytoplasm of a cell. Let's see. Ribosomes, they assist in the process of protein synthesis. Golgi apparatus assist in packaging products to be secreted from the cell. So the answer is going to be mitochondria. Mr. Lawson now says he's been out of school for a long time. I understand you lose it if if you don't see this stuff. I tell my students the reason why I stay up on it is because I teach it. I have to stay up on it. So I see it all the time. If it wasn't for that, a lot of this stuff I would forget. And there's going to be some things that's just going to stay with you. Some of these things that you all learn in school, you will never forget. It's going to be foundational, right? You just always going to remember. Then there's going to be those things that you're going to forget. Some of you all are going to go to specific specialties and you're going to know everything about that specialty and you're going to forget about other specialties. For an example, the first specialty I worked in was GYN. So working there, I knew everything about GYN. And then I went to go work in family practice and I had to relearn a lot of things that I learned in school. Right. And so, I get it. I say all that to say, I get it. I get it. Shalandra says she's been working in occupational therapy. She's glad to be back. Okay. Oh no, she says she's been working OT. Oh, I see. I'm sorry, Shalandra. I see OT. See, you know what? That's a lesson right there. I was just recently talking to my students. We were talking about abbreviations, and we were talking about how abbreviations can mean so many different things depending on the context. So when she said OT, I immediately thought occupational therapy, right? But the context, she's saying she's glad to be back. So obviously she meant working OT overtime. Thank you for that lesson, Shalandra. Um, Haley's. Oh, I was right. Oh, so I was. Oh, okay, I was right. Occupational therapy. Okay. Haley says, which exam should I take first, NHA or CMA? It depends on your school. What is your school offering, Haley? It depends. One school I worked at, we offered the RMA exam. The school that I work for now, that we offer CCMA, so it depends. It just depends on what your school offers. If they're giving you a choice, Haley, I would say go for the CCMA. Now, I'm going to tell you why I say that. I say that because the CCMA certified clinical, in my experience, and also from talking to other instructors, the CCMA exam, we tend to have a higher passing rate because it's a lot of clinical questions, certified clinical medical assistant. So if I had to choose, I would say go with the CCMA. The questions are, even though as we can see here, you will have some administrative questions, but you won't have a lot of administrative questions. The RMA, if I had to pick which one is the hardest, I don't even want to go there because I've had people ask me that before. Well, I brought it up. I'll just go there. I would say, and I don't want to say the hardest, but I would say the broadest, right? Will probably be the CMA exam. I would say the broadest is probably CMA, meaning the CMA exam, RMA as well, it has everything, but I know for a fact the CMA exam, in my experience, is more broader, meaning it has a lot of everything in it, right? Um, I say all that to say that if they're giving you a choice, go with NHA. Another thing I love about NHA is that they provide so many resources for you. They have the study guide and a practice test, and the study guide literally goes over everything. It literally, I mean, these questions that I do get from from the NHA study guide. I try to change them a little bit into my own words, but they give you so much. Like when you're taking the NHA and you get that study guide, there's no way that you will not come across everything you'll need to know. The questions won't be exact on a practice test, right? But you have everything you need to know. That's another thing I love about NHA. So yeah, Haley, if you could choose NHA. That's just my preference, All right, let's see. Brittany says for finals we had to fill out the form ourselves. Which form, Brittany? The claim form? Um Claudine says which exam can she take for MA? Depends. Are you clinical MA or administrative? If you're clinical, you could take the CCMA, which we're going over now. This which is certified clinical medical assistant, the RMA, which is registered medical assistant, and then the CMA, which is certified medical assistant. And I have a in my notes to do a video on that. Hope maybe this week or next week's. Had a few people request a video on the differences between each one, so I'll be doing that soon if you need some further information on each one. But those are the tests that you can take. Can you give me the study guide for MA? Claudine, if you check out my channel, I just did a video on how to access the NHA study guide. It's pretty easy. If you go to the NHA website, it's pretty easy to navigate, but I did do a video last week on how to get access to the study guide. You're welcome, Haley. All right, let's keep it moving, ladies and gentlemen. Which route is more accurate when checking a patient's temperature? Axillary, rectal, oral, or temporal? Which is going to give you the more accurate temperature? Okay, so I see B and D. All right, let's see. So the answer is going to be rectal. Rectal is always going to give you the most accurate temperature. Axillary or temporal, they may give you oral may give you a slightly higher temperature. Axillary or temporal may give you lower. Veronica says, I have a question. Can I write the CMA and phlebotomy? I'm guessing you mean, can you take the CMA and phlebotomy at the same time? So it depends, Veronica. on your school that you're in. So, um, phlebotomy may be included. It may be an included certification. It may be included in your course, or your school may require that you take it separately. So it kind of depends on your school, whether you can take them both at the same time. But phlebotomy is usually included in the course, and you can get certified. But then some schools, they do make you, they're like, phlebotomy is included in your curriculum and in your labs, but then you may have to pay for the actual certification. So I would check with your school. Um, and so actually, yeah, rectal for infants, is still going to be B for infants. Haley. So if you're working in pediatrics and you're dealing with babies, you will be taking their temperature rectal. I actually worked for a pediatrician. They did not want anything except rectal, so we had to do all the babies rectal. Um, let's see. Oh yeah, Haley, I see you changed it. Yeah, B for kids. Oh, Haley, it's like you said, D for infants, B for kids. So yeah, D is actually going to be, um, B is actually going to be the best choice. Brittany said yes, a claim form. Veronica said she meant certificate. CMA, yeah. So yeah, I would ask your school, Veronica. Good question. All right, next question. A patient calls in and is nervous about test results, which is an appropriate response. The doctor's busy right now and will call you back. You don't really want me to give you the results, do you? I'm afraid it's bad news. I would get a second opinion if I were you. Don't worry about it until we say you have something to worry about. Try to relax. I know you're concerned about your test results. We'll call you as soon as your results come in. Another scenario question. Read each one. See which one is the best fit. Okay, so I'm seeing a majority D. Let's see. Anything else? All right, I see. Those of you that chose D, you're correct. So again, eliminating those things. So we know we're not going to say anything like this to the patient. You know, the doctor's busy. We'll call you back. You don't really want me to give you the results, do you? Like some of these answers literally make me laugh. I'm afraid it's bad news. I would get a second opinion. Of course, we could never say that to a patient. First of all, as medical assistants, whether clinical or administrative, it is outside of our scope to even tell the patient that it's bad news. Even if we're looking right at the result in front of us and we can see that it's bad news, it is outside of our scope. Unless the provider instructs us to give the patient a result, we cannot, okay? Don't worry about it until we say you have something to worry about. Try to relax. We don't want to give um, assurance to the patient, right? We don't want to tell them don't worry about it because they may have something really to worry about. The best thing we're going to say, we're going to acknowledge that they're concerned, acknowledge their anxiety, right? I know you're concerned. We'll call you as soon as your results come in. Okay. All right. When writing a business correspondence using a simplified letter style, which of the following features should you use? A complimentary closing, a subject line in all capital letters, and then in paragraphs in the body of the letter, center a line, date line, and salutation. Simplified letter style. So yes, you want to know these letter styles. Your simplified letter styles, block, full block. You want to make sure you know these letter styles because as you can see, you may see it on the test. Mr. Lostford said if it's COVID, let them know. You know what, Mr. Lostford, you just made me think of something. You know, I've been teaching for so long now. I have not worked in the office during these times. I don't know how things are working now. Maybe providers are, giving the medical assistants the go ahead to give COVID results without checking with them first. I don't know. Normally, like I said, results have to go through the provider first, but we are in unprecedented times, so I can't even say that that's incorrect because I'm not working in the office. I haven't been in an office since 2017, so I don't know. Maybe they are just letting them give the results. All right. I see A and D and B. Okay, I see a good mix. Nobody picked C, but I see A, D, and B. All right, so let's see. Let's see. Oh, it's another B. Okay. All right. So if you chose B, that is correct. So if simplified letter style, there's not going to be a complementary closing, so it wouldn't be A. The indented paragraphs in the body of the letter, it wouldn't be that because everything in the simplified letter style is going to be flushed to the left. So it's not going to be C. And then center aligned date line and salutation. Nope, they're not going to be centered because again, everything is going to be flushed to the left. So again, make sure you all are familiarizing yourself with these letter styles. Okay. All right. Pyloric stenosis is a condition of which of the following body systems? Urinary, gastrointestinal, nervous, or cardiovascular? If a patient has pyloric stenosis, that is a condition of which of the following body systems? Is it urinary system, GI, nervous, or cardiovascular? Okay, let's see. D and B. So far, I'm seeing B and D. Pyloric stenosis. All right, so let's see. All right, so if you chose B, GI, that is correct. So pyloric stenosis. So this is referring to stenosis of the pyloric sphincter, and that's a part of the stomach, right? Which aids with our digestion. Okay, so that's going to be GI. That's one of the reasons why you want to make sure you're able to recognize certain. Um, you want to be able to recognize certain structures of each of the body systems, so that way when you see pyloric, you know, oh, that's a part of the stomach. That's GI, right? Urinary, that includes, the bladder, the urethras, the ureters. The nervous system is your brain, the nerves, right? Your spinal cord. Cardiovascular is your heart, your blood vessels, right? So be able to recognize structures of those systems. And I want to quiz you all real quick. What's stenosis? Anybody know what stenosis is? I know some of you all are still in school. That's a medical term. What stenosis refers? What does stenosis refer to? Just a quick quiz, real quick. If anybody knows, comment down in the comment section. Stenosis. What is stenosis? Stenosis. If anybody knows what stenosis is. If you don't know, make sure you know because you'll see it on the test. It may say something like a patient has stenosis of the something. So that means they have what of that, so you want to make sure you know what that is. Anybody? Okay, so stenosis refers to narrowing. Narrowing. Stenosis refers to narrowing. So that's going to be narrowing of the pyloric sphincter. Restriction of blood vessels or narrowing of blood vessels. Or did you mean restriction of blood vessels, Shalandra? If that's the case, yes. If it's narrow, then yes, it will be restriction. It will be not necessarily of the blood vessels, but stenosis can refer to restriction of the blood vessels, or in this case, pyloric sphincter, narrowing of the spinal cord. So just narrowing. So yeah, narrowing. Okay. All right. So I just wanted to kind of throw that in there. So make sure you add that to your notes if you don't already have it. All right, next question. Which of the following statements should you make when explaining venipuncture to a patient? I'll be collecting a blood sample from you today. There will be a small stick in your arm. I'm here to draw a blood sample for a test. It won't hurt at all. I'll be puncturing your vein with this needle. Hopefully you won't feel the vacuum in the tube. As I draw your blood. D, I'm going to draw a blood sample. I'm sure that you aren't going to faint. That should probably say feel the vacuum as the tube draws your blood. Alrighty. Looks like a majority of you are saying A. All right, let's see. You all are correct. A is the correct answer. That's the most professional. I'll be collecting the blood sample. There'll be a small stick on your arm. Don't ever tell the patient it's not going to hurt. That's one thing that I always tell my students. If don't say it's not going to hurt. If anything, you can say it'll just be a small stick. So when a patient asks me, is it going to hurt? I don't say yes, and I just say it'll be quick. That's how I answer. It'll be quick. Don't ever tell a child it's not going to hurt, because then that child is going to be mad at you when it does hurt. Just say it's going to be really quick, a small stick, really quick. Then we definitely don't want to say I'll be puncturing your vein with this needle. That sounds harsh. I'm going to draw your blood. I'll be drawing a blood sample. I'm sure that you aren't going to faint. We don't know that. We can't give them that assurance. Okay. All right. You have to apply ointment to a patient's wound. Which should you use to remove the medication from the jar? A gloved finger, a syringe, a cotton ball, or a tongue blade? You have to apply ointment to a patient's wound. How are you going to get that ointment out of the jar? What do you want to use? Okay, I'm seeing D and C. Seeing D and C. Okay, so it looks like everybody's pretty certain that it's not A or B. Okay, so we're between C and D. I see a lot of C and D. All right, let's see. Okay, so this is going to be D, tongue blade. All right, so of course we knew it wasn't going to be just a glove finger. Like that's not enough. Um, we and your glove finger may have been touching stuff. You know, you don't want to use just your glove finger. And a syringe, we know we need liquid. It would need to be a liquid to use a syringe. Cotton ball as well will be. It would need to be like a liquid, like a not an ointment, something liquid, right? The first thing that came to my mind is like a lotion, right? Something like that. You can use a cotton ball, not ointment, because it can stick to it. But the tongue blade, and when we say tongue blade, we're talking about a disposable tongue blades that look like big popsicle sticks, not the metal tongue blades, but the disposable ones, right? So we're going to use that to get the medication out the jar and apply to the patient's wound. All right. No, okay. This is okay. Hypertension. Stage 2 hypertension can be identified by which of the following blood pressure readings: 110 over 80, 135 over 80, 150 over 95, or 120 over 85. Stage 2 hypertension. Okay, let's see. All right. I see D, I see C. All right, so let's see. Looks like the majority of everybody's choosing C. Oh, I think that D was actually for the last question, maybe. Okay, so it looks like everybody's choosing C. And you are correct. So 150 over 95 is going to be considered stage 2. Now this has changed over the years. I'm realizing that what they consider stage 1 or stage 2 have changed over the years, because back when I was in school, 150 um would have been stage 1. Well, actually, maybe not. You know what? No, 95 would have been considered stage 1, definitely. But these things change over the years. And I will say this too, depends on where you look. So certain health websites that you go to, things may be different. Of course, because we're on NHA practice tests, we want to go by what they say. But I just wanted to kind of put that out there. Don't be surprised if you're looking online or your book or whatever, and it's a little different, right? 110 is good. 135 over 80 and 120 over 85 will be considered stage 1. The reason why I say things are a little bit different because before, 120 over 85 would still be considered good. But now that would actually be considered stage 1 hypertension. All right. Another administrative question. You're reviewing a Medicare claim denial and realize the charges exceed the usual, customary, reasonable fees. Which action should you take? Are you going to leave the unpaid balance on the record until the end of the revenue cycle? Are you going to wait until an overpayment of an approximate amount balances the deficit? Are you going to adjust the patient's account to reflect no unpaid charges and write off the balance? Or are you going to request payment at the point of service during the patient's next visit? And this is one I'll give you a little bit more time for. I'll let you read all of those and think about it. Give you a little extra time for this one. Okay. C and C and D. Give a few more seconds, see if any other answers pop up. C and D so far. All right, let's see. All right, so if you chose C, the answer is correct. Let's talk about that for a second. So, first of all, Medicare denied it because the charges were too much. First of all, when the provider accepts Medicare, they have agreed that their fee schedule or charges, right? They've agreed that they are not going to exceed what Medicare allows, right? So if that provider if the provider's charges has exceeded what they agreed to, guess what? They have to write that off. They have to write off their balance. They can't try to charge that patient. Let's just say, for an example, let's say Medicare's allowable charge for the procedure is $300, and the provider's trying to charge $400. They're going to have to write that $100 off because they've agreed to. They are required, not even just agree, they are required to adhere to Medicare's guidelines that the charges cannot exceed what Medicare allows. Now, the usual, customary, reasonable fees, those are determined by different things. So, like, what are the usual fees for a certain procedure or service? That's one of the things they look at. What's customary, right? What are providers in the same specialty charging for this service or procedure in the same geographical area, right? That matters. Geographical area matters because, like, for an example, I'm on the East Coast, I'm in DC. Our cost of living is different from California, so their charges may be higher on that side, right? Same for DC compared to like South Carolina. Their cost of living is cheaper down there, so our providers wouldn't charge the same down there as they do up here. And then reasonable, like, what's reasonable? What's a reasonable fee? Like, what are, they look at things like how much a provider has to pay their employees. There's so many different things that they look at to determine these fees, and the provider has to agree that I'm not going to charge more than these fees, right? This is what Medicare is allowing, so I got to adhere to that. All right. Oh, all right. I know I kind of went left with that, but I wanted to make sure you all understood that. All right. What action should you take when removing a tick from a patient's leg after a tick bite? Are you going to grasp the tick at a point furthest from the skin? Squeeze the body of the tick firmly to remove it? Use tweezers to pull the tick away from the skin slowly? Discard the tick in the trash can. The patient has a tick bite and you have to remove the tick. Okay, C, C, B. All right, looks like the majority of people saying C. I see one B, but it looks like the majority of people are choosing C. Let's see. All right, so the answer is going to be C. We want to use tweezers to pull the tick away from the skin slowly. So A, we can kind of already rule out because it says at the point furthest from the skin. We need to be closest to the skin, right? Squeeze the body. The reason why it's not going to be that one is because we could crush the body of the tick, and then ticks carry infection. So we don't want to potentially crush the body of the tick and then spread infection, and that's another reason why D is not the answer as well, because we want to discard it in something that we can conceal and discard away from regular trash because they carry disease. All right, I think we had just few more questions. All right, a patient who has a body mass index BMI of 23 should be categorized as which of the following: obese, underweight, normal weight, or overweight? BMI of 23. What is that considered? Claudine, did you say CB? You chose both C and B? Okay, Haley says C. All right, Dan says C. Sonia says Sonia. I'm sorry, is it Sonia or Sonia? I'm sorry. All right, look, the majority of people are saying C. Let's see. And C is correct. So 23 is normal. That's a normal BMI. Anything between 18 and a half to 24.9 is normal. So obese would be if the patient had a BMI of 30 or more. Underweight would be under the 18 and a half. And then overweight would be between 25 to 29.9. So this is a good one to know. So another example of making sure you understand these incorrect answers. So make sure you know the BMIs of each one. Obese was 30 plus. Underweight is under 18.5. Normal is between 18 and a half to 24.9. And then overweight was between 25 to 29.9. Just in case you see a question, maybe they may say a patient's who is underweight, their BMI will be, and because that's the thing about these questions. That's why I tell you, don't get caught up in the question itself. Pay attention to the content. So make sure you know the BMI for each of these categories. All right, which of the following can be used for an orthopedic exam? Goniometer, hemostat, retractor, or tonometer? Goniometer, hemostat, retractor, or tonometer? Orthopedic exam. Okay, I'm seeing C. All right, let's see. C, I see C. See B. All right, this one looks like it's going to be a tricky one because I see everybody's choosing B and C. All right, so it's going to be goniometer. So that's used to measure joint movement. So that's going to be the correct answer. That's can be used for orthopedic exams. So it's a good one to add to your notes if you don't already have it. Hemostat, that's used for grasping tissue and blood vessels during a procedure. Retractors also used on a surgical procedure. Retractors look like a little fork, look like a double-sided fork that is used to keep the tissue open during a surgical procedure. And then tonometer, that is used for um, eye procedures using the ophthalmologist's office. This is definitely a good one to add to your notes if you don't already have it. All right. How should you communicate with a patient who has moderate hearing loss and reads lips? Are you going to use hand gestures, speak loudly, speak slowly, or are you going to over enunciate your words? Your patient, she has moderate hearing loss, but she does read lips. Use hand gestures, speak loudly, speak slowly, over enunciate your words. Okay, let's see, CMA. CD. See CAD. I see CAD, coronary artery disease. All right, see mostly C's. Okay, see another A. All right, let's see. All right, so the answer actually is going to be use hand gestures. Like I get the temptation to choose speak slowly, but speaking slowly for a patient who reads lips is not necessary because they know how to read lips, right? So you can just talk normal. So that's why C is not going to be the answer because they know how to read lips. Speaking loudly, one thing I've noticed, speaking loudly, they always, I don't think anybody chose, well, one person did choose B, but speak loudly is not going to be the answer. I've noticed with these hard of hearing questions, speak loudly is never going to be the answer. Even though, real life, when I have my hard of hearing patients, I do speak louder, but I'm not yelling um, and one thing I do tell my students sometimes, especially for those of us who've worked in the office for a while, some answers, like for an example, to speak loudly, as I mentioned, I do speak in a louder tone with my hard of hearing patients. I've noticed like some of these questions, they will, it kind of goes against what what you would know, what you do in the office. But one thing I always remind my students is to just think about book answers. Think about the most professional. Think about what they would want you to say, right? Speaking loudly. Although, okay, yeah, we do know that we do have to raise our voice a little bit, but it's not what is considered professional, right? Hand gestures, however, is considered professional because if the patient can see what we're referring to, we're talking about blood pressure, we got to draw their blood or whatever, using hand gestures will help them understand you better. Over enunciating is not really going to do anything to help the patient read your lips any better. So hopefully that made sense. I know some of these questions are kind of tricky because sometimes you're like, but wait a minute, this is what I do, or that doesn't make sense. But this is one of the reasons why we have these sessions so that we can talk about why this is the answer and why this is not the answer. All right. Which of the following actions should you take when preparing a patient for a procedure to have a mole excised? Are you going to administer the anesthetic to the patient, don sterile gloves and gown, cleanse the site with surgical soap and an antiseptic, or open a sterile pack and lay instruments on the counter? All right, let's see. B and C. All right, let's see. All right, so we're going to cleanse the site with surgical soap and an antiseptic, right? So A, we can already eliminate. That's outside of our scope. We can't administer the anesthetic to the patient. Now, will we eventually put on sterile gloves and a gown? Yes, but that's going to come later. That's going to come after we've cleansed the site with surgical soap and an antiseptic, right? When we're cleansing a site with the surgical soap and antiseptic, we haven't steriled up yet. We haven't put on our sterile gown and our sterile gloves and stuff just yet. We're cleansing the site with the surgical soap and antiseptic, but we are not sterile yet. And then this knowledge comes with, for those of you that's learning right now, you all have probably learned your, learning your steps with sterile hand washing, and then learning your sterile gloves and learning how to clean the site and things like that. So you probably have already learned those steps, so you would know that, right? And then open a sterile pack and lay instruments on the counter. We can rule that one out because we're not going to lay them on the counter. We're going to lay them in the sterile field. So most that's going to be on a Mayo stand, right? Um, and and laying them on a counter. Maybe there are instances where you create your sterile field on the counter, but it didn't say sterile field, so that's why that's not the answer. Because just laying it on the counter, that's not sterile. Okay. So hopefully that helped. Let's see. Last question. When measuring the circumference of an infant's head, which of the following actions should you take? Position the infant prone on the exam table. Place the measuring tape so it covers the infant's ears. Place a zero mark of the measuring tape against the infant's forehead. Mark the measuring tape and record the measurement after the visit. Okay. Mostly B and C. I see a D. All right, let's see. All right, so if you chose C, place a zero mark on a measuring tape against the infant's forehead. That is going to be correct. So you want to start, and I'm actually going to do a video on this. I'm showing you all how to measure the infant's head, measuring the infant's head circumference. I'll do a video on that, but yeah, you want to place a zero mark of the measuring tape against the infant's forehead. Prone, we can automatically eliminate that because the baby is laying face down. We don't measure the baby laying face down. If anything, they'll be in a supine position, right? Which is laying on their back face up. Place the measuring tape so it covers the infant's ears. No, we rule that out because we don't want to cover the patient's ears. And then mark the measuring tape and record the measurement after the visit. Another one we can eliminate because after the visit, the doctor needs the measuring during the visit, right? Not after the visit. So we can rule that out as well. So ladies and gentlemen, thank you for hanging in here with me for this hour. For those of you all, this is your first time, welcome. Thank you for joining me tonight. There's a few people who are always here. Got to shout you out, Shalandra, Veronica, Brittany. They are always here. Haley's been here before, so I just wanted to shout you all out, real quick. You all are always on here when I go live. So I'm hoping that this has been helpful to you all. Do me a favor, if it's been helpful, if you can exit out of the live chat box and just hit the thumbs up button for me, so that way it can, it helps with the algorithm and getting the video out to more people. Thank you all. If you haven't already subscribed, go ahead and subscribe to my channel. I do have a lot more content coming up. I have decided to be more active with this channel. I have a personal YouTube channel as well, but I have been spending a lot of time, kind of focusing on this channel. I want to make sure I'm helping as many people as I can. Just seeing the comments and seeing how many people I've been helping. This is what I love to do. I love medical assistant. I love teaching. So I will continue to do these videos. If you have video suggestions, please leave them in the comment section, or you can email me. Let me know what you want to see. One of the videos I got coming up, as I mentioned, the differences between the certifications. Another video I'm going to talk about some do's and don'ts of on externship. One thing too I want to put out there, I want to do some interviews. I did put it out there before. I want to know, people that are, open to coming on the channel and kind of, going live with me one day and talking about your experience as an MA, especially those of you working through the pandemic. I want to start doing some medical assistant interviews where just having somebody go on here, I ask you some questions about your experience and things like that. You can give some advice to other MAs that's new to the field. Another thing I also put out there on my resume video, if you are willing to go live and, we go over your resume together, I'm only choosing one person. Email me. I'll be choosing a person for that. So I got a few things coming up. Haley says, where can I message you? So K Hart khartcpr@gmail.com. It's in the description. Haley khartcpr. Let me just go ahead and type it here. That's my email. khartcpr@gmail.com. So that's my email, Haley. So you can email me there. Like I said, I do want to get some interviews. So let me know for those of you that's willing to come on live and do this. Video suggestions, questions, let me know. All right. Veronica says you rocked as always. Oh, thank you, Veronica. You're welcome, Claudine. You're welcome, Dan. Sure, Ali. You're welcome. Thank you all for sticking with me tonight. I just want to make sure. Thank you as always. You're welcome, Shalandra. Have a good night, ladies and gentlemen. You too. You too. Marshall says I took my exam today. I watched your part one and want to say it helped tremendously. I'm anxious. Oh, Marshall, let me know as soon as you know. Comment under the video as soon as you know. I wish you much luck on that. There was somebody at the beginning who said they passed their test today. I'm gonna have to go back and screenshot that because I want to shout them out. So as you guys are passing your test, come back and let me know so I can shout you out like I did at the beginning of this video. You're welcome, Haley. All right, just want to make sure nothing else. Marshall says will do. All right, ladies and gentlemen. And I'll include that link to that medical assistant group as well. I'll do that in the comment section. So look out for that, Haley. I know you said you wanted that information. All right, guys, you all have a good evening. Thank you.